Hello guys, today we are gonna learn about the gas gangrene. So gas gangrene is a rapidly spreading edematous myonecrosis that occurs in the crushed wounds. Okay, that occurs in the crushed wounds. So now the organism that causing gas gangrene is what? Clostridium perfringens. So Clostridium perfringens, this is the organism that causes, this is the most common organism. So other organisms that causes are like Clostridium histolyticum and Clostridium tertium and Clostridium novi. Remember these three mainly. So these are the other organisms that causes gas gangrene. So gas gangrene, development of gas gangrene. So gas gangrene requires two types of environments. Okay, one is anaerobic environment, another one is contamination of the wound. So okay, anaerobic conditions like in crushed wounds. Okay, in crushed wounds, road traffic accidents like and open fractures, injuries, there is tissue, like there is disruption of the blood supply to the tissue, which causes tissue ischemia and causes anaerobic environment. Then contamination of the wounds. So any contamination of the open wounds. Okay, open wounds by spores. Okay, open wounds by the spores or the blood like non-traumatic gas gangrene will occur through the hematogenous spread of the muscles through bowel clostridia. So in our bowel, clostridia is present. Okay, so through this bowel, non-traumatic gas gangrene will occur through hematogenous spread. Okay, hematogenous spread. Now we'll learn about the virulence factors. Okay, virulence factors. So it will produce two types of virulence factors. One is alpha toxin, another one is theta toxin. Okay, now alpha toxin is the principal virulence factors. Okay, it is the principal virulence factors. It has both phospholipase C and sphingomyelinase. Okay, sphingomyelinase activase. Okay, so these two factors are present in this alpha toxin. So what they will do is they will activate the platelet adhesion molecule. So okay, they will activate platelet adhesion. So they will activate the platelet adhesion molecule and the neutrophil receptors. Okay, now this will cause aggregation of the platelets. Aggregation of platelets and neutrophils. Okay, this will cause aggregation of the platelets and the neutrophils. This will cause obviously accumulation, but what will cause occlusion. Okay, so this will cause the occlusion, and this alpha toxin, it will directly suppress the myocardial contractility. This will lead to decreased cardiac output, and this will cause hypotension. Okay, remember this also, it will suppress the myocardial contractility, which will decrease the cardiac output and which will cause the hypotension. So now we'll learn about theta toxin. Okay, what will theta toxin do? So this theta toxin, it will cause vasodilation. Okay, this will cause the vasodilation. It doesn't have that much role in the pathogenesis. Okay, so now this is now clinical manifestations. So what are the clinical manifestations? Now if we talk about the incubation period, okay, it will depend on different organisms. Means now Clostridium perfringens, this is the main organism, and its incubation period is 10 to 48 hours. Now Clostridium novi, its incubation period is 5 to 6 days. Okay, remember these two mainly. Clostridium perfringens and Clostridium novi. Okay. Now, what are the clinical features? Not the clinical features. One is severe, like sudden onset of pain. Now, sudden and excruciating pain. Okay, it's severe pain, excruciating pain on the affected area. Now, another clinical feature is rapid development of the foul smelling serosanguinous fluid. Okay, foul smelling serosanguinous fluid. Okay, now there you will get gas bubbles in the muscles. And you will see edema. Okay, edema. Then because of all this and there is no oxygen all, you will get shock and organ failure. Okay, organ failure. And this all have high mortality rate. Okay, high mortality rate. Remember, it has sudden and excruciating pain and foul smelling serosanguinous fluid, and you can see gas bubbles, edema, shock and organ failure. Okay, now we'll see the laboratory diagnosis. Okay, so in the laboratory diagnosis, first specimen. So which specimen you are using is, one is necrotic tissue. Okay, necrotic tissue, muscle fragments, okay, and tissues from the wounds. Okay, wounds, you will all use this as a specimen. So after this, when you see under direct microscopy, you will see thick, stubby, box car shaped gram positive bacilli. Okay, gram positive bacilli. So how you will see thick box car shaped gram positive bacilli. Okay, gram positive, or this all you need to draw in the examination. So now culture media you use to transport the specimens are Robertson, cooked meat. Okay, cooked meat broth culture that is used. Now for identification of this Clostridium perfringens, the tests you are going to do are, one is target hemolysis. There you will see double zone hemolysis. Double zone hemolysis will indicate that is Clostridium perfringens. And another is Nagler's reaction. Okay, Nagler's reaction. In Nagler's reaction, you will see an opalescence. Okay, opalescence that is surrounding around that egg yolk agar. Okay, now another one is reverse cam test is positive. Reverse cam test is positive, and the heat tolerance is positive. Heat tolerance is positive. And in the litmus milk, it will produce a stormy clot reaction. Okay, litmus, I'm writing here, litmus produces stormy clot reaction. Okay, so these are all the things you need to do. Specimen is from that necrotic tissue, muscle fragments, all that, and the direct microscopy you are gonna see thick stubby boxcar shaped gram positive bacilli, and this is like this. And in the culture that is used to transport is Robertson cooked meat broth. And other things for identification of the itis Clostridium perfringens, the test you are going to do is target hemolysis. You are going to see double zone, Nagler's reaction, opalescence streak around that egg yolk agar, reverse cam test is positive, heat tolerance test is positive, and the litmus you are gonna see stormy clot reaction. Okay, that's all the video guys. I hope you like it. Thank you. Subscribe.